Okay, let's go ahead and get started. I want to welcome everybody today to our Heart Health in the African American community. This presentation is going to be brought to you by all of us, the University of Arizona, Banner Health, and the National Sorority of Phi Delta Kappa. My name is Tony Wheaton. I'm an engagement coordinator with the Phoenix UA campus, and I'm happy to be here. We're going to go ahead and get started with we'll start with Miss McClendon today. We can get to her slides. Okay. Just want to give an introduction with Ms. McClendon. Ms. McClendon is a clinical service manager for Banner Health. She has been a nurse for over 33 years and currently serves as an adjunct faculty member at the United States University in the College of Business and Technology. She holds a Master of Business Administration with an emphasis in healthcare management from the University of Phoenix, as well as a Master's of Science in Leadership from Grand Canyon University. Ms. McClendon also serves as a board member on the All of Us UA Banner Participant Engagement Board. Take it away, Ms. McClendon.
Hi, everyone. We're going to look at a video real quick and we'll get right into this segment.
I represent a group that has historically been underrepresented in research.
Most studies and most clinical trials have always been with the average white male.
Upper middle class, middle age.
Don't look at me as the average, as the blanket, as a statistic. I need you to deal with me as me.
Diversity strengthens the science. It could bridge some civil rights issues and inequities in healthcare across all races and ethnicities.
Whether the focus is asthma, whether the focus is infant mortality, whether the focus is diabetes, cancer or heart disease, communities of color are disproportionately impacted by them.
Diabetes, high blood pressure, obesity, illnesses that Black women get and die from needs to be researched.
For once, a group of researchers have actually specifically sought out the underrepresented groups in society to make sure that we're represented in research.
If we delve deeper into where we live, what we consume, what we do, that will have an impact on trying to prevent diseases in the future.
We'll have the information from 1 million people. People of color, LGBT people, people from diverse communities.
This study is actually purposefully involving on a large scale diversity.
Precision medicine will allow us to study our individual genes and allow you to get the right medicine at the right time for the right person.
You're going to have some individuals that are going to say, yes, good, we're getting in on the ground level of a study. And then you're going to have those that have some trepidations about it.
Tuskegee happened, we're not trying to hide that or sweep it under the rug, but communities of color will be at a disadvantage if we do not find ways to get by that.
This isn't going to be some sort of Tuskegee experiment. This is going to be the community working together with healthcare institutions.
To bring them aboard and let them know that this is for the greater good.
We get back that trust by involving the community.
It is important for minorities to be a part of this, or we will again be left with medications that are created for really other populations.
It's definitely important to have participant engagement and individuals being partners from the ground up.
When the samples comes to us, they are really going to come to us with a biobank ID. We will not know exactly who those people are, and it's going to be really highly secured by the data center for the program.
I think a part of that response as an African American is to stand up and say that I'm willing to participate.
And I think people will be very excited about being a part of what is going to be the next revolution in healthcare in America. This will get us eons ahead of where we are as far as specific treatments for specific illnesses in specific people.
With all of the information that we're going to garner from this study, it is going to help with prevention. Prevention is really what the key right now to longevity.
My hope would be that the All of Us research program would just get people to really be aware and understand that by them being proactive and joining, that it helps other people.
It's very, very important for them to be a part of the study so that we can affect what's causing their problems, not only now, hopefully, but down the road with their children and their children's children.
I'm hopeful that we will be overwhelmed with folks.
I represent a group.
All right, thank you, Tony. I'm sure everyone was really impacted by that video. It really hits to the heart because I'm sure we've heard those statements or we might have said them ourselves. So we want to talk a little bit about what is NIH, which is All of Us Research Program. So the All of Us Research Program, as was mentioned in the video, is very historic because this is the first of its kind that's gathering data for 1 million people living in the United States. And we can really use this information to, excel healthcare and make health equal with the lifestyle, looking at lifestyle, social economics, environments, and biology. So hopefully in the future, these researchers can, discover preventative treatment and care that's precise for us. Next slide. So what is precision medicine? They mentioned that several times in that video. Precision medicine, of course, is just a new approach for disease treatment and prevention because it takes into account veritable things such as lifestyle, socioeconomics, the environment, and biology. I'm sure many people saw the controversy about the Roundup weed killer that was causing non-Hodgkin lymphoma and chronic lymphatic leukemia. And so that information was linked and found out from the World Health Organization in their study by the Specialized Research Agency. So research itself is really having a radical shift in how each of us can receive the best care possible. And it's based on our unique makeup. Next slide. So some questions that we feel that all of us, and just research in general, will answer is maybe how can we prevent chronic pain? We know that it affects more than 100 million people in the US, but in the African American community, we have a higher rate along with Hispanic with experiencing chronic pain. And it could be anything from joint pain, from obesity, diabetic neuropathy pain, from the diabetes. And so if we can come up with new ways to help with that pain level, then it would really improve not only just our community, but other communities as well. And they can develop pain medicine that maybe wouldn't be so addictive, because now we have to limit how much pain medicine we can receive because we're not sure how addictive it will become. Or we could slow potentially or stop different kinds of dementia. We know that in the African American community that we suffer from what they call vascular dementia. So with that, it's related to the high cholesterol and the high blood pressure that is prevalent in our community. So if we can get these people, these individuals on medication sooner that are anti-high cholesterol, anti-hypertension, then we would be able to hopefully slow down or prevent dementia from developing. And then of course, we always need better treatments for diabetes, which is affecting several African American. I mean, right now the CDC mentions that 4.9 million people have diabetes, and 77% of them are already diagnosed. So if we can find out what works for each individual race, it would make it an easier process for prescribing medications, for developing treatments. And then, of course, we can develop more cures for cancer, which is always an ongoing struggle, from breast cancer to the African American male with prostate cancer. They're doing research and determining that if they can be screened a little bit earlier, we might be able to get a treatment plan for them. Our drive is to sustain interventions that's going to support this health equity. Next slide. So what is the promise to you as a participant? Because the average person want to know, what am I going to get out of this type of program? So you have the opportunity to improve your health for future generation, learn about your own health. Just ensure that everybody in your community is included. So it's not just particular people that can participate, everyone can participate. And you can also learn about additional research opportunities. So they will occasionally send you out information and see what your interest is about other research. This is a long-term relationship. So we want to make sure that over time, we just keep developing new processes. Next slide. So the current protocol for all of us is, of course, you enroll in consent. So you got to authorize us to use your electronic health record. We're recruiting 18 years and older. And hopefully in the future, we want to move to children, because we know that children are impacted by several disease processes early due to genetics or environment. Answering surveys, they'll send you out surveys occasionally for you to answer. We collect physical measurements, which is your blood pressure, heart rate, weight, hip circumference, just try to see what we can do to adjust your health level. We get blood, sometimes saliva, urine specimen, and just any biosamples that can be stored in that program biobank. And now we've been advancing, coming soon, to get integrated apps that you'll be able to track your mood, your cardiorespiratory fitness. So everybody's moving more to application management for healthcare. Next slide. So all of us highlight, we know for a fact we've done over 1,050 research projects, and they're being conducted and data collected. We're also exploring a wide variety of health conditions. So of course, many of them do impact the African American community, because we have some typical disease processes that just are prevalent to our population. So we're going to click ahead for some relevant research highlights. Next slide. So we've been looking at Pharmacogenetic Genomics, which is a study to look at the frequency of variants in clinical relevant genes in African American population. So with all of us, they have been collecting samples that they can test our genetic makeup, DNA. And so they recently, sent out last year some results from different participants' DNA. And I think that was a help for them to know from historically what genetic traits they would probably experience during the lifetime of, research or just living in a certain region of the country. Next slide. And then we're looking at gastrointestinal health. We know that functional gastrointestinal disorders is prevalent among African American patients, and this one study was looking to explore what common functional GI diseases are out there, which irritable bowel syndrome, IBS, of course, is the biggest one. And it's also has been researched and found in African American children, with African American girls more at risk. So it is definitely something that needs more research so that we can start at an early age addressing these gastrointestinal problems, so that as they become adults, they won't have to deal with that. Next slide. So adverse perinatal and birth outcomes among ethnic minorities. So we know already that African American moms experience higher rate of perinatal mood and anxiety disorder, preterm birth and low birth weight when compared to Caucasian women. And of course, it's been attributed to environmental stress, unhealthy behaviors, maybe they are eating a lot, because a lot of times you will hear them say, well, I'm eating for 2 people or 1 people and extra, and actually you can overeat. So just working with them and giving them the results from research that, they should look at a different diet plan to make sure that their baby is healthy as well as themselves, and that they're able to get to a good birth, a birth weight that's is really a birth weight that is better for them and for the baby. So with all of us, we're just looking at a lot of areas, and all of the areas have about the same level of importance. So if you get a chance to look more into it, just read about it, consider signing up, and then make sure you promote it among your relatives and friends, because it's very important to our race. Thank you.
Thank you so much, Ms. McClendon, for that presentation. We want to try and get over to Dr. Brady to see if she is actually able to speak on the presentation. Dr. Brady, can you hear me?
I can hear you. Yes, thank you.
Hey, how are you?
I am well. How about you?
I'm doing well. It's so good to see you. We're going to go ahead and present you. You're going to be talking about, or Dr. Brady is going to be talking about heart disease and health disparities in the African American community. We can go to the next slide. Just want to introduce her. Dr. Brady is a full-time faculty member with the Arizona College of Nursing, as well as at the Chamberlain College of Nursing. She possesses over 35 years of experience, primarily in women's health and administration and leadership roles. Over the past 15 years, Dr. Brady's focus has changed to nursing education. One of her greatest passions is enhancing learning for aspiring nurses, and she considers herself to be a true lifelong learner. You can take it away, Dr. Brady.
Thank you, Tony. I appreciate you. I am currently educating aspiring nurses at Arizona College of Nursing at the Tempe campus in regards to community health education. Health disparities and vulnerable populations is a part of our curriculum that we go over all the time. Those disparities will become a part of equity and inequity, and it is a local as well as a global perspective. Americans, African Americans that is, are living longer than they had been tracked in 2000. And because of those health disparities, it means that they're still dying at an early age. When we compare all of those things that are going on from 1999 to 2015, it shows that younger African-American people in the ages of 20s, 30s, and 40s are dying from diseases that typically are found in older Americans. Next slide, please. Health disparities are often due to economic as well as social conditions. The lower individual socioeconomic position, the higher their risk and poor health will be noted. And we also have found historically that literacy is also a health disparity. And so then when clients are saying that they cannot see their doctors because of cost, we can most likely attribute that to inadequate insurance. There's no specialists that live in a lot of the rural areas. And so then there may be some isolation that will be there, and also problems with their transportation. So they'll use the emergency department as their means of primary care. African Americans most likely will die at an early age, and that can be found from stress, also from stroke, hypertension, cancer, diabetes-related problems. We found that suicide as well as homicide is also a problem, and behavioral health or mental health issues has been tracked as well. So they're more likely to have problems like obesity. And when we're finding that their leisure time has been limited, their body weight and compared to their white counterparts has been also affected. Next slide, please. So according to the Office of Minority Health in 2018, African Americans were 30% more likely to die from heart disease. And we can ask ourselves why. So evidence-based practice, having us look at the literature, will be able to give us some information that a lot of African Americans, they're staying home a lot longer. They're ignoring the signs and the symptoms that are attributed to poor health. About 40% of African American adults are more likely to have high blood pressure, and it's really not controlled. Hypertension, also known as high blood pressure, is a silent killer. And so then some clients may or may not even realize that they do have hypertensive kinds of problems. They may have been diagnosed and prescribed medication, but what we're finding historically is that a lot of African Americans are choosing not to take their medication because of the side effects. It can be that spontaneous dry cough. It can also be that they're running to the restroom because a lot of the blood pressure medications have water pills added too. So instead of speaking to their practitioner, then they stop taking it, which makes their problems a whole lot worse. So the best practice, as we can always say, would be for them to follow up with their practitioner, know the numbers, know those signs and symptoms, and report them as soon as possible. Next slide, please. Heart disease, when we're looking at our female counterpart as well, African American women, nearly 60% are more likely to have high blood pressure than their white counterpart as well. Could it be related to stress? We may say yes. Stress will have in that female worried about the bills that they cannot meet. When those dollars are just not meeting and agreeing, then they're up all night long, they're unable to sleep, and then that causes the problem as well. Childcare, transportation, all of those kinds of things. Going to the stores that have the mom and pop next door on the corner bodegas will have them picking up foods that are inappropriately sold. And so then what we find then is more obesity with this female client. She may have more hypertensive kind of issues, high cholesterol, and cigarette smoking and or secondhand smoking as well. Next slide, please. So what can providers do? They can eliminate cultural barriers, such as insecurities that they can find, misunderstandings with a lot of African Americans, and building trust with a practitioner, if you will. And so then more direct communication would be needed. The negative impacts on shared decision can really, for true, be a deal breaker. So when we're thinking about how we can collaborate with the practitioner, then allowing that patient, client, customer then to have more input in their healthcare planning. Next slide, please. And what individuals can do. What we're finding now is that more elder clients are hesitant to speak up. Could it be trust? Could it be insecurity? It could be any of all of those kinds of things. We would be able to say that we are not able to walk in everyone's shoe. So then we're not finding out exactly what the problems are, because a lot of African Americans just feel that they're not sharing. Could it be an elder? Could it be a young person? And so then those would be something that we can find also. They're not disclosing all of their medical health problems. So what we would be able to do then is fill the gap, the disparity that remains from health disparities that we can find disproportionately affect members of racial, ethnic minorities, and any of the underserved as well as the vulnerable population. And with that, overall health then is still a challenge for us as healthcare providers. So we turn to problems, we turn to resources, we turn to all of us research as far as initiatives to help with those alleviating any health disparities. Thank you.
Thank you so much, Dr. Brady, for that good information.
You're welcome.
Really appreciate it. We want to go on and we're going to be hearing from Dr. Allen next. Dr. Allen's going to be talking about the Community Engagement Alliance. Next slide. Go ahead and introduce Dr. Allen. Dr. Allen is a community research scientist with the Arizona Community Engagement Alliance Against COVID-19 Disparities, Associate Clinical Research Program Director at Banner Health, and a clinical assistant professor at ASU. She also serves as the chair for the All of Us U Arizona Banner Participant Engagement Board. Dr. Allen is heavily involved in the community, working on mentorship programs through the National Black Nurses Association, as well as engaging with the medical community about issues such as cultural competence in clinical situations and COVID-19 health disparities. Take it away, Dr. Allen.
Thank you very much. So what is CO? And I think this was, Tony did a phenomenal job in actually identifying the acronyms. The Community Engagement Alliance Against COVID-19 Disparities is an NIH, similar to All of Us, effort guided by our community to engage our researchers, particularly alongside trusted community organizations and messengers. We are so familiar with, in the last 2 years, a pandemic that was identified as COVID-19. We are familiar with this because this pandemic, as you know, originated in a foreign environment and was introduced throughout our country. Yet it affected more African Americans than any. This is a group that probably least likely traveled abroad. If you go to the next slide, the mission of AZCO, and this is why it's so important, I'll talk a little bit about how the impact of COVID-19 and AZCO plays a part, is to provide a trustworthy science-based information through active community engagement outreach to people who are hardest hit by the pandemic, with the goal of building long-lasting partnerships, as well as improving diversity and inclusion in our research response to COVID-19. Next slide. So what are our contributions to CO? So the contributions to CO, as mentioned even in the earlier presentation of All of Us, we're looking at what we consider an ecosystem of partners and trusted leaders that will provide and promote CO works and success. Our trusted leader may be those of researchers such as ourselves on this call, and also myself, working in the communities as it relates to COVID-19 on projects that were identified through long haulers, and this is the aftermath of COVID-19, then on projects that relates to PASC, which is actually post-acute sequela COVID-19. And again, these are the ending results. It also looks at policymakers, those who have made a difference and a change, and how we are actually addressing the needs of those in the community. Those we consider the basically the disproportionate community members. We also look at faith-based organizations. Again, this is identified as the most trusted individuals in almost all of the communities we've actually done focus groups and talked about who would be considered the most trusted individuals when we're looking at engaging our people in the community as it relates to, again, COVID-19. And we have identified that as faith-based leaders, faith-based community members. We also looked at community-based organizations such as our sororities and fraternities and other organizations in which we've already established relationships, as well as professional associations such as Black nurses and medical organizations. Next slide. So what are we doing with CO in Arizona? The Arizona CO program is a part of 11 state alliances funded by NIH. And what's so unique about Arizona is that we identify where our heaviest hit is primarily was identified with the Native American and Hispanics, but our hardest hit is African Americans because they were considered the hardest reached in areas that we weren't able to identify. We were able to collaborate with University of Arizona, Arizona State University, Northern Arizona University, as well as Mayo Clinic in Scottsdale to lead this effort to identify those individuals. Next slide. So as participants, what we want you to do is obviously to be involved, just like in the All of Us and other studies. We want to learn about the experiences, the concerns, the attitudes and needs regarding COVID-19. What do you know about COVID-19? Is this information factual as it relates to COVID-19? Is it information that is provided to you by our government, such as the CDC or World Health Organization? Or is it information that was retrieved from Facebook or other unreliable sources? Testing, we want to share with you how and where you can get testing. How is basically on various levels, such as saliva or, as you know, nasal swab. Where is all the areas in which we started out, as you all may remember, in large congregant areas such as the state fair or either in State Farm football stadium and some hospital areas. We've launched out into now hospitals, clinics, as well as Walgreens, CVS, so that we can actually get that hardest hit or hardest reached areas. We've even started to begin testing inside of our faith-based and community-based organizations. For vaccines, now this is the one that was considered the most challenging. People were okay to get tested when they seen that it was obviously some exhibited signs and symptoms of COVID-19, where they were having that cough, sniffles, fever, or just not feeling well, or, as you know, perhaps not wanting to get any of their family members or friends contact with the COVID-19 because of the poor outcomes of death that we've seen. But one of the greatest concerns that we had was the vaccines, because of the myth that many people have actually shared. The myth of vaccines being given to people because there was a chip, or perhaps this vaccine was given to individuals just so that they can track individuals or infect them further with COVID-19. But we have, based on the science, discovered that vaccines were not as such. Vaccines were just like any other vaccine, the flu vaccines and all the others that you've received in the past. We've provided, with SEAL, we provided factual information. We had town hall meetings. 6 months ago, we've had a town hall meeting where we had Kamizia Corbett, the developer of the Moderna vaccine, sharing how effective the vaccine was and how important the vaccine will be even in the future. The vaccine as it relates to the booster, and even recognizing whether there is a need for further vaccinations and boosters. And last but not least, our goal was to also recognize preventive measures. As mentioned earlier, we heard about cancer, diabetes, and also hypertension, and how these have played a huge part on our African American community, unfortunately identifying us as number one. Well, yes, we have been considered as number one when it comes to COVID-19. And some of those comorbidities that you've just heard have enhanced the possibility of having the people retrieve COVID-19. The information that participants provide will help you and us develop more and relevant information that is distributed to a culturally appropriate community. Material, whereas you could see in this picture, well, you'll see images of African Americans obviously sharing their stories or sharing why it's important that we enlighten our family members as it relates to COVID-19. Also, it allows us to help answer questions and answers that will give more information about the past mistrust that we've identified. I know in some cases, people have talked about the Tuskegee study and the Henrietta Lacks study and how those things have gone awry. But as we know, even today, we have those concerns, those mishaps, but we also have now more information on how we can be more involved in research when it comes to IRB, which is institutional review boards, where they actually recognize where there are FDA approved and approved human-related studies, and people can be, again, more involved as it relates to COVID-19. Next slide. So how can you get more involved in SEAL? And again, this is Community Engagement Alliance. We ask that you obviously scan the little heart shape. That will actually populate on your phone. You will have a survey that takes about 10 to 15 minutes. And one thing I like about this, because I actually have this survey on my phone, We usually or tend to get information about COVID-19 if we're looking at CNN or looking at the news, or obviously the World Health Organization or CDC will populate on some of our famous websites. Well, with this information, your phone will actually populate all of this update information in real time. I can recall when I received an email stating that children can now get vaccines. I had received that information populated on my phone through this scan barcode about an hour prior to its announcement. So this information gives you real time and answer questions that you may not have or may not be privy to before this information is released. So again, we ask that you visit seal.arizona.edu or call or text to join at 844-844-3004 to enroll in the study. Thank you.
Thank you so much, Dr. Allen, for that information. The next part of our presentation, we have some question and answer session. Let me take a look and see if we have any questions so far. We do, and this is for Dr. Allen. Do you host vaccine events at the same time that you provide information, town halls, events, etc.? Is it best to separate the vaccine to avoid potential pressure?
That's a very good question. When we started the vaccinations, we would hold those vaccine events simultaneously. And then by trial and error, we realized that prior to our vaccine events, we would actually do a presentation. Recently, one of our African-American faith-based organizations did a phenomenal job in vaccinating individuals. And when we discovered that they were actually going to vaccinate them 1 week prior, we were able to do a virtual presentation to answer questions on COVID-19 and the various vaccines so that more people can sign up and they can get information in real time. We also do vaccines and have a medical professional on site to answer questions for individuals who may have them.
Okay. There's another question, and let me see, it says the African-American population in Arizona is extremely small. Do you think because of the numbers are so small, government or organizations don't focus on this group as they view their return information too low?
I would let the others.
That could be. You know, when we're thinking about health disparities and such in those smaller communities like that one, when we do a census tract, that can be a reason why not a lot of resources are distributed because of the size in those neighborhoods, in those areas. And so with that, then we need the key informant. We need that person that would be that faith-based person. We need someone that would be able to help speak up, public health nurses and as well as other healthcare providers. When we can all collaborate together, then even though some of those communities are small, the voices will be large, and then that does make a difference as well.
Okay.
I'd like to piggyback off of what Dr. Brady stated. So I totally agree with you. Part of my research is outside of COVID-19 is also in Alzheimer's disease. And sometimes you have to have a strong researcher, particularly one who looks like the audience. So you're right, we're about 7-8%, give or take, percentage of African Americans. But when your voice is loud enough and you share that there is a concern and we need to address that concern, and you go beyond the state of Arizona and go at a national level, like for myself, it's Us Against Alzheimer's, which is a federally identified research on Alzheimer's. And I spoke loud and said that here, we do have African Americans here, a lot that are traveling and a lot that actually are transporting here. And we do have a voice as well, and we would like to be heard. So I totally agree with Dr. Brady that once you have someone who is an advocate for you and for your community, yes, you will be heard.
Exactly.
Great answer. This is for Dr. Allen. What are the benefits of participating or joining SEAL?
Oh my God. So let me just start quickly by the first benefit is what I just shared with you. the information that you give, yes, they're going to ask for your demographic information, but not any detailed information that's going to obviously make you concerned. But as I shared, every Monday, typically on a Monday, I will get information that will populate on my phone. And the information would be, how are you? Just checking in. Do you want to know the latest information about COVID-19, a new variant? I know when Omicron was released, I found out on my phone and not from social media. All of this information is through CDC. It also allow me to know where there's recent or current updates on vaccines, local areas. I was able to share with my congregation where they could actually get tested when the testing process occurred, or where they can get vaccinated when vaccinations are concerned as well. So again, it's just real-time information. And again, it allowed me to share or express myself on the input on COVID-19. And again, you're at the table with these actual NIH researchers that are dealing with COVID-19.
And then this is another question. Why is diversity in research important? How is All of Us different from other research programs?
Diversity in research, I mean, that's how we learn that, when we know, we grow. And so then as we are researchers, nurses, epidemiologists, and all of the other vocations that may be out there, to research and find out what would be a best practice in caregiving, care supporting, resources where people can go for whatever service. We need the researchers, all of us, to coin that phrase there, all of us to get together and support, and in order to find out how we can better every community that of which we stand to serve, then we would need that research in order to get out there, do our windshield surveys, walk around in neighborhoods, do interviews, do our surveys. And so then those would be a part of research and identifying problems that then can possibly be alleviated.
And I would like to piggyback off of Dr. Brady. All of Us program is really different in the fact that never before have we looked at individual races or groups as close as we have now. And with that program too, I mentioned the surveys. They really get your opinion of what do you want them to research and what's important to you as a community for us to look at. And then also, it's important in what's special about All of Us research is that it's gonna cover us through time. So this will take care of our children, our grandchildren, and any future great-grand or whatever. So we can find out these disease process, medications, treatments that's gonna work now, and then we can prevent and change the way their health feels in the future.
I also like to piggyback off of that, because one of the things that I always tell my audience when I'm speaking about All of Us is that, again, you've heard this phrase, if you are not at the table, you are on the table. And what that means is that oftentimes people will say, and I've heard colleagues say this and my community members, I didn't know that the pill for Black people will work different than the pill for another person. And my response is, had you been involved in the research prior to the pill being released from the FDA, you would have known. There was a blood pressure pill, and I choose not to say a lot about it, that we found a large percentage of African Americans who actually had taken that blood pressure pill began to have problems with swelling of the throat. They actually were having problems breathing. And they discovered that it was more African Americans than any other ethnic group. When you go back and you look at some of the research, and when they were testing those medications, there was a very low number of African Americans who actually participated in whether that medication will work appropriately. So All of Us, to me, is so important, because what you're doing is you're saying, hey, here I am today. I'm giving you my information, whether it's the information as far as my voice or whether it's information as far as my blood type or my saliva. I want to know before you release anything, is it going to work for my community? And that's why all of us, to me, is so important to have more of our minority population, particularly our African-American, being involved in that database so that we can actually be recruited in real time in any study that may take place at that time.
Yeah.
Great. Next question is, how have you seen diversity in research affect your student/curriculum when teaching?
For me, at the Arizona College, as I have those aspiring nurses there, community health is my specialty. That's what I engage them in. And diversity is something that, because the population of the students is not all of understanding that, okay, well, you know what, we need to do a windshield survey. We're going into homeless shelter areas. We're going into food banks. We're doing something. So diversity hits us in a lot of different avenues. And because of that, then I have to, as an educator, have to broaden their mind and letting them know that you're going to see a variety of persons in every community. And so white, black, different. And so then you'll know that how you would be able to modify your communication, if you will, how you would be able to not be judgmental, if you will, not to be able to then just like say, oh, well, you know what, they're just not taking their medication and they should have known better, giving out literature to persons when they may have some problems with reading and understanding. And so then being that educator, then I have to then broaden the horizons of those students, those nurses that are coming to be able to enter to any community and then be able to look around and see things in a different text.
I like the way you stated that. At Arizona State University, I have delighted to teach 3 courses. One is called Culture and Health, so it's understanding their culture as it relates to health. The other 2 are Evidence-Based Practice and Nursing Research. And so oftentimes in my head, I don't know which one I'm teaching because I try to combine them all together. Yeah. I try to teach my students, at whether it's undergraduate or graduate level, that as an African-American instructor, first and foremost, I introduce myself in that way. And I talk about some of the social determinants of health that have impacted my community. I then enlighten them on how research and how they can make a difference in research by actually identifying those needs. Most researchers will often reach out and identify what is it that I can do to research, to develop a new study, or to go based on the evidence that's already there and apply it to our real-time information or our real world. And so what I do is I share with them, you are the innovators, you are the creators. As nurses, one of the things about nurses, we are researchers, scientists, and artists, innovators. And so you can create whatever you want. And when I begin to allow them to see the most innovative aspect of life, not just the person who's putting an IV in or to draw blood or to give medication, but a person who can truly make a difference and make an impact based on the information that they've learned in my class. Some of my students have never, ever talked about African Americans, Native Americans, Hispanics, or others until they've reached my class. And so I have to take them from chapter 1 on why we make a difference, and then end in chapter 2 and share with them how they can make a difference by understanding the diversity of our community.
Exactly, yes.
That was great. I feel so inspired. The next question we have is, what kind of transparency to participants does our program offer when we're talking about SEAL and All of Us?
So I can talk about a little bit about SEAL, transparency, and I love that term, transparency or being candid. You know, the way I break down transparency, and when I talk about Arizona Community Engagement Alliance program, I give them statistics. I share with them, you know, we only have a list of 6 to 7% of African Americans in our community. But let me tell you, of those 6 to 7%, how many have been affected by COVID-19? I then go into detail and not just talk about the impact of COVID-19 as from the individual standpoint, but the impact of COVID-19 as it may have impacted them from their family members. Recently, I just lost my nephew's grandmother, a really good friend, and then I just found out another good friend. You look at the social media, you saw that Tyson, I think it's Tyree, excuse me, who just lost his mother a few days ago. My transparency always start with, how has this disease impacted you? I do that with Alzheimer's disease as well by sharing with them how it impacted me. And then I go into statistics and tell them how, what, and why it's so important. And you may hear in my voice the passion that I have on any disease I talk about. I heard that from the speakers here with all of us in the cardiovascular disease. So my transparency, or candidness, if you will, starts off with stories, statistics, and real life information that may impact them.
Okay.
And for me to piggyback off on all of us research, we tend to operate the same way. So normally when I host events and I speak about all of us, I start out just emotionally with personal experience, you know, because I have not been a participant of research in the past, but I let them know why I changed and why I became a participant and what it has done to not only for to improve my health, but as well as other family members, friends, and associates. So I think the transparency is that if you join, I'm not speaking to you as somebody that's saying, hey, go and get started with this research program. I'm speaking to you from somebody who's tried the program. I know it works, and it's really been beneficial for everyone that I've put in contact with this program.
And as an educator, then yes, you have to be that visionary. You have to then be a motivator, have to be able to empower people to then just like want to stand up and then speak out on things that they can see, but then will not feel to like engage in. And so then when you inspire them, when you just like can pave the way and then just like show them a different avenue on what they would be able to make a difference in, then those are the ones that are becoming a little bit more political. Those are the nurses and those that are in the avenues that are standing up for women's rights and all of those kinds of things, and joining various organizations of which we should be like encouraging those to be a part of. So being transparent, you know, in whatever our role would be, is always beneficial to those that are coming after us. And as we align with the people of like minds, then we do make a difference. And so it does take all of us. It takes that village, if you will, to be able to then speak up about what is going on in the community of which we live, whether it's local or global, and then be able to share that and inspire others to do the same.
Okay. Our next question is for research that is actively happening. What is one suggestion that you have for research coordinators who work directly with participants that traditionally are underrepresented in research?
Be passionate about that cause. If you're passionate about that cause, then you will delve deeper into searching literature to find out what had been, all of those trends and issues around and before. And so then those would be the ones then that can just like, okay, I have an idea on how we can make something else just like work and align that with what had been. And then it grows from there, because that's what research would be. We have a cause, and if we're passionate enough, then we would be able to then move forward with.
I would say know your audience as well. I agree with Dr. Brady, but know your audience. You can walk into an environment and not know the cause, not really know, like for instance, I've gone into an environment where I may not really know what's going on with this community, but if I did my research on the community, and I'll give you the perfect example. I speak all over the Valley. I speak actually at an international level as well. And I can tell you in particular, and I smile when I say this, I knew I was going to talk about Alzheimer's disease in this particular presentation, but my audience was in Scottsdale. And I walked in the room and there were a large number of Caucasian, older age individuals. And I said to myself, I needed to do my research. I looked at the socioeconomic situation. I knew ethnically who these individuals were, perhaps their background. And I walked into the room and I began to tell a story, not my story, but their story. And when I told their story, I got their attention. And then midway through my presentation, I started to talk about the presentation. So knowing your audience and letting them know that you are there for them is so important when I present, because I want to make sure that I am not imposing my beliefs. I'm not imposing what I do as a researcher and telling people to get vaccinated for COVID, for, you know, as it relates to COVID-19. But what I'm doing is I'm saying to them, I understand that you have lack of access to your vaccinations. I understand there may be some concerns because of the past history that you've heard about. I understand that there may be lack of funding due to the fact that you don't know where to go and how to get it, or you may not be insured. I understand all of that. But midway through, I then tell them, and this is why you need to be involved in all of us. This is why you need to get your blood pressure taken. This is why you need to get your colon checked. This is why you need to just get tested for COVID-19. And once you get tested and once you look around you and see that how many people in your family or friends that have died, then you make the decision whether you need to get vaccinated.
That's true. The why is the evidence. If we can go as nurses all the way back to Florence Nightingale, Lillian Wall, and any of the others that came before, it's the why that keeps people in research to delve in and then just like uncover. Why are we washing our hands so much? You know, why is this sanitation that important? So it's the why that builds research and researchers to keep moving forward.
Yes, and those research coordinators too can look at trying to see what resources are available that they can take in with them when they're presenting, but also maybe people in a community that has a influence on that particular group and have them come in as a guest speaker.
Yeah, that's right.
Big. And the final question of the night is for Ms. McClendon. Are there groups or outreach opportunities for our African American community when there is a fear of organized healthcare, or where there is no healthcare? Heart health is important.
Right, heart health is important, and it's various groups all over the United States. So, you know, now that we're in a virtual environment, they could find a group online, or they probably have several that are in Arizona. We could probably get together and, you know, look up a resource list that we could send out, but most of everything is available online now, and it's a group for everything. For the breastfeeding mom support group for African American moms, since that's not something that we normally participate in. We have the support group for diabetes, you know, and a lot of the healthcare organizations, such as the hospitals, clinics, they are offering support group meetings, but their main problem, they said right now, is getting the right group in there for the sessions. So, you know, just start looking and calling, you know, most of them have it advertised on their sites, and you can find plenty to get signed up for, and they really strong support groups, and they really help.
Perfect. I want to thank our panelists today, Dr. Allen, Ms. McClendon, and Dr. Brady, for being with us today. And let everybody know that we do have a post-webinar survey that you guys should fill out. It'll be on the screen. Just click the link, and if you don't click the link, we'll also email that to you tomorrow. So I just wanted to also thank you guys for letting me facilitate this great presentation, and I'm just happy.
Well, I thank you also. It was totally my pleasure.
Yeah.
And just stay well, everyone.
Right.
Yes. Thank you very much.
All of us.
That's
so
right.
much. Everyone have a great night.
Thank you. You as well.